everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO of Adjacent Health, Karen Deli. How are you?
Good. Good morning. Nice to meet you.
Did you hear that? I swallowed my tongue when I said, how are you?
Give me a chance, I'll match you.
It's this 40 ounces of coffee I have right here. It's just making me talk, very fast, but I'm trying to slow it down for this episode. I'm so excited to chat with you here today, Karen. Let's dive right in. Tell the audience a little bit about you.
Absolutely. And I'm excited too. I just didn't have as much coffee, so I may not talk as fast. I actually have spent my entire career, greater than a quarter century, focused in clinical healthcare operations, really looking at ways to enable care for anyone, anywhere, at any time, with a focus on trying to optimize physician workflow and process. So, and different than I think a lot of when you hear that, you think about productivity and money. In my case, I'm really focused on sustainable quality care delivery and physician satisfaction, which in my belief then equals productivity. So how I've done that, which I think is what's a little bit of unique about me, is through telehealth, but for over 25 years. So I started in the space when my primary tools were Inmarsat radio and faxing. So we've come a long way since then. And along the way, I've just been incredibly fortunate to be able to take my passion for clinical operations and combine that with a curiosity in technology and innovation and really be at the forefront of developing and implementing telehealth solutions. So for me, Adjacent Health is really the culmination of a career spent in a space that's now very popular that once we had to defend it when I started.
And I just think your story too about how Adjacent kind of carves out of Teladoc is so interesting. Talk us through more about why that came to be, and I guess how collaborative that relationship is still today, and why maybe it's even better.
Yeah, absolutely. So we were started my division, which we provide physician services in the hospital setting. So primarily neurological care, but also critical care and some other things. We first did that under the InTouch Health umbrella, which is, Teladoc acquired InTouch. And that opportunity between InTouch and Teladoc really gave me the chance to take years of workflow development and combine it with the best technology in the world around telehealth and build what I think are the best solutions: sustainable, high quality, reliable, and importantly, our physicians really enjoy working with us. Inside the Teladoc organization, our work was just a little bit different. Clearly, we're telehealth, we're patient focused, but they were direct to patient is their primary business. We were focused in the hospital environment. And we came to a decision together that if we were separated, we might be able to grow more quickly because we'd be able to get more resources focused specifically on our needs. And so it was definitely a mutual decision. Teladoc and we are still partners. They are still part of the business as owners. And we've separated in January, and our success just in the 10 months has been phenomenal. It's just been a tremendous partnership. And we feel really fortunate to continue to have our business dedicated to that platform.
I guess talk the audience through. I might have skipped this step a little bit too. Because I'm so excited to do this. Talk us through, why you view Adjacent Health kind of being at the forefront of that hospital budget, staff, and like what these virtual care solutions are doing, and how you're utilizing your background every day to continue building something special here.
Yeah, and I think pre-COVID, right? Telestroke care was one of the first specialties that was adopted, accepted, became a standard of care through the American Heart Association. So there's a lot of evidence to support our primary business. What I think again makes us special and puts us makes us a leader is the team. We had the opportunity to come together under that InTouch Teladoc umbrella as a group of people who had been working in telehealth and specifically in telestroke in different environments. We pulled an incredible team together. And just as important as leveraging our successes, I think we were each able to leverage our failures. When you're first in a space, you make all the mistakes. And to have an opportunity to do that over with a partner like Teladoc and build kind of the ultimate solution. We had all the expertise on physicians and operations, and then the best technology partner. I just think we positioned ourselves for complete success. And it's, a lot of companies have temporary success, I'll call it. But in telehealth, there's things that happen as you scale. And from your background, Jared, a lot of it has to do with that credentialing and licensing and all of that. As it becomes overwhelming. And I think finding solutions that are scalable is critical. And that's, I think, what our secret sauce is.
I call those type of problems the uh, banging your head on a desk problem, because that's how they first come about, right? Once you're willing to hit your head off the table, it's an annoying problem that will have to be solved. And it's tough to fully solve some of these things, right? Like you mentioned, credentialing. It, we worked on it. We were able to get it to a decent point, but whenever you also have to get the government and all these multiple parties involved, you can only do so much with it. Is what we found. Now, you've obviously had a long career in virtual neurology, as you've said. I'm curious about, you know, over the course of that career, what's changed? What are some of the interesting innovations that you're looking at? And my favorite question to ask any guest: where are we going? Where are we heading? What's the future look like? So paint us a
That's a
picture.
loaded question.
That is a loaded question.
It is. There's a lot, right? So I mean, I think just if you look at clinically, a lot has changed. When we first started doing telestroke, it was all about at the time TPA delivery. Now there's so many more therapies available. That identifying the right patients for the right therapy in the minimal amount of time. And so I think what we continue to innovate on is how do we make that process more efficient? How do we get better at identifying those patients and getting them to the right places in the right amount of time? So that's on the clinical side. I think lots of literature and conversation around that. The technology continues to evolve. There's no question about that. And I think for companies like ourselves, what is interesting is that hospitals now have so many more choices about the platforms that they use. How do we, as a company that has many customers with many technology platforms, how do we make it work for our physicians so they're not dealing with 20, 30 different platforms? So I think that the technology continues to evolve. I think the other thing, though, what two other big areas, one is just the people, the physicians, and it's changed so much just since COVID. There's so much more focus on work-life balance. When I started, it was just understood that you work 24 hours a day and you didn't have your holidays and you didn't have your weekends. And now, physicians are really trying to find a balance. And so it's being creative about the models by which we pay physicians and incent them. And then I think the other thing that we just touched on is the whole credentialing licensing area. And again, since COVID, so much has changed. It used to be all the challenges around licensing and credentialing at the hospital, but now as things are freeing up and there's more money and reimbursement available, now we have to incorporate payer credentialing and all of that. And so that continues to be behind as government is, and continues to certainly be a challenge. So all that said, where's it going? I think medicine's going to continue to evolve. And so ensuring that we are always ahead one step of where the clinical piece is going so that we can pace and match our workflow and process so that we can be as efficient as possible as new medicine, new therapies, new opportunities are present for patients.
Do you think gone are the days where these hospitals would kind of engage in all these different multiple pilots with all these early stage companies? Like, do you think they've become more picky and they need to see more well-built solutions backed by, obviously you were carved out of Teladoc. Like, do you think that is mattering more than working with early stage companies as well?
There's a couple of answers there. I do think that hospitals increasingly are looking to simplify and not have to have many contracts. And I think, so there's a lot of trends out in the marketplace where companies are trying to do everything. I don't think that's necessarily an answer, because I don't think if you're good at neurology, you're necessarily good at something else. I mean, I think you can do too much and not be good at anything is a risk. So finding creative ways for companies to work together and maybe have single contracting solutions for hospitals. The other thing that I'm personally very passionate about is just the quality associated with telemedicine. And pre-COVID, there weren't a whole lot of standards, and so during COVID, you kind of saw this, the crazy boom of all kinds of telehealth. Telehealth isn't for every scenario every time, and I think really honing in on what is quality telehealth and where is it appropriate to use it and how to use it, how to control it, how to measure, manage it. I think those things are going to continue to be really talking points and for hospitals important as they evaluate. They have choices now. They didn't have choices before. So I think that's a really important dialogue. And I hope that we can keep adjacent at the forefront of that. But like I told you, I started focused on quality, and that absolutely is for us the most important thing.
I love it. And what excites you? I'm sure there's a lot about what excites you about what's next for adjacent. But if you had to only pick a few things, what excites you about what's next?
Just that there is a what's next, right? Like I said, I've had just a tremendous career, and I've met a lot of great people and have, had the opportunity to work with some terrific companies. And now I have my own team, and we get to kind of pick our destiny. And I really feel like I have the dream team. Everybody left Teladoc that was on my team, stayed with our team, all doctors, all employees, all customers, which I think just tells you a lot about our organization. We're all pulling in the same direction, and we're just so excited about what we can accomplish. Again, with patient first, quality first, always at the forefront for us.
I love it. Karen, I hope we can have you come back on again real soon and we can dive into some more topics. But really appreciate you sharing the Adjacent Health story with us today, kind of how that carve out process worked and why it made sense. And also just painting us a picture for what's next and what the future holds.
Well, we thank you for having us, and we look forward to talking to you again.